you may meet a pain nurse as part of your pain management journey. Watch Rachel Whipp and Rebecca Kennedy from Hunter Pain Specialists explain the supportive role of nursing to treat chronic back pain.
Hi, I'm Rachel and this is Rebecca. We are nurses at Hunter Pain Specialists. We're here to explain the role that we play in caring for patients with back pain. Approximately 1 in 4 Australians are affected by back pain each day. And for some of these patients, this becomes a chronic pain condition that affects their everyday quality of life. At Hunter Pain Specialists, our pain management nursing team is responsible for the provision of safe and effective standards of care, including consultation, education, assessment and patient support to those suffering this often debilitating condition. In many cases, there is no cure for chronic back pain, and the main focus in the care of these patients becomes optimising their pain management in order to help them live more fulfilling and active lives. Once a patient has been referred to one of our pain specialists, they have access to a wide range of treatment modalities. These include medication, psychology, physical therapy, procedural interventions, and advanced pain therapies such as spinal cord stimulation. At your first consultation with the specialist, medication management is a part of the initial treatment process. Changes to patients' medications may occur at this time and continue throughout treatment. Part of our nurses' role is phone triaging. This means that they are an easily accessible resource for patients who may wish to discuss aspects of their care, including recommendations made by the specialist, medication side effects, efficacy, and any other medication-related concerns the patient may have. Evidence has shown that management of back pain is most effective with a multi-modal approach. What does this mean exactly? It means that multiple methods are used in conjunction to achieve the best outcome for the patient. As mentioned earlier, in addition to medication, some of these modalities may include psychology, physical therapy, procedural interventions, and advanced pain therapies.
Our nursing team provide a pivot point between healthcare providers and offer an open line of communication, which helps to enable continuity of care for our patients. Our nursing team are also able to identify and assess patients who may not have psychological or physical therapy input and can provide the appropriate referrals. The next step in a patient's journey may involve procedural interventions. There are many procedural interventions that can be recommended by our pain specialists. These include an array of injections, nerve blocks, and radiofrequency neurotomies. Often this can be an overwhelming experience, but our nurses are there to support and guide our patients through their pain journey. As with medication management, our nurses are a valuable resource for patients who may wish to discuss concerns or request further information regarding these procedures in order for them to feel more supported and better equipped to be actively involved in their care. Our nurses also provide post-operative follow-up for patients who have undergone an interventional procedure. Our nurses contact patients the following day after a procedure in order to assess the patient for any potential complications and again to provide an opportunity for the patient to discuss any concerns that they may have. If a patient is yet to achieve a satisfactory result with the aforementioned treatment modalities, they may be recommended for an advanced pain therapy such as spinal cord stimulation or an intrathecal drug pump.
So what is spinal cord stimulation? This is where a small implantable device that sends a mild electrical current to the spinal cord is used to relieve chronic persistent back pain. The nursing team are heavily involved with all the patients who have been recommended for this therapy. Once the patient has been recommended for spinal cord stimulation, they will be assigned a nursing case manager. The assigned nurse is then responsible for the education, assessment and support throughout this process. The nurse will educate the patient on the particular device that has been recommended for them at an education session, where there is the opportunity for an open discussion between the patient and the nurse around what is involved. Following the education session, permitting the patient wishes to proceed, the nurse will organise for the patient to undergo a temporary trial of the device, which usually lasts between 7 and 10 days. During this trial, the nurse will contact the patient on a daily basis to follow up, offer support and advice, and assess the outcome of the stimulation. If the patient has a positive outcome from their trial, then they may move ahead with a permanent implant. The nurse will schedule a theatre date for this to occur, liaise with all relevant parties involved in the process, and organise any pre-operative pathology. Once implanted, the patient is followed up by the nurse with both a post-operative phone call and a wound review at 10 days.
The nurse's involvement does not stop there. One of the advantages of having a nurse case manager assigned is that the patient not only has access to specialised nursing care whilst ever they have a spinal cord stimulator, but they have the benefits of continuity of care and the opportunity to develop a therapeutic relationship with their nurse. An alternative advanced pain therapy is intrathecal drug delivery. This is achieved by implanting a reservoir containing pain-relieving medication into the patient's abdomen that allows the delivery of very small doses of medication into the intrathecal space near the spinal cord via a catheter. This method of drug delivery allows patients to achieve greater analgesic benefit from much smaller doses than what they would require as compared to oral administration. As with spinal cord stimulation, the pain management nurse is heavily involved in the management and support of patients who have intrathecal drug pumps. Their role includes educating patients prior to implant, refilling the reservoirs when required, attending to any dose changes as advised by the treating specialist, post-operative follow-up and wound care after implant, patient assessment and ongoing clinical support as required by the patient. Pain management nurses play an integral role in the treatment of patients with chronic back pain by providing support, advice and education as well as patient advocacy. Nurse case management in particular enables improved access, communication, coordination and involvement in decision making as well as better healthcare transitions.
To summarise, the involvement of pain management nurses play a vital role in the pain management process of patients suffering chronic back pain, which can be fundamental in achieving the best outcomes for the patient, allowing them to reach their full potential.